Dr. Rachna Dwivedi, Midlife Committee Chair, Management Committee Chairperson, Fogsi, here going for another flow of knowledge, the Gyan Pravah 78th episode. Our visionary president and leader of Beyond Words, what she has shown us the path every night at 8 p.m. All the committee chairpersons are here with us, sharing one or the other celebrity opinion and gaining knowledge and diversity, various field of the work done by national and international faculties. So here we are starting our episode with profound gratitude and being a part of this Fogsi team with our esteemed President Dr. Sunita Tandulwadkar Madam. We evidence the standing ovation, what she has done in 94 days, just 94 days. And it was a proud privilege to be a part of her team. Respected Yuvraj Manavendra Gohil sir, I welcome you all in this podcast. And just to show a glimpse, Madam has got so many projects with us. You can see it with me here. Know your number. We have got a barcode for everything. She is working on the complete dimension of all the female. When we were educating, I think knowing the blood group was something which was like people didn't know. Now with Know Your Numbers, there's a Sampoon maternal care, and there are so many Anubandhan, Fogsi Anubandham. This is what she started for the first time, that we are meeting our Fogsi president in the zonal way. All the presidents and secretaries are interacting with Madam, sharing their problems nationwide. And Gyan Pravah, where we are standing today, Do Teeke Zindagi Ke, that is her vaccination drive for the cervical cancer Mukt Bharat. And here we stand with her initiative with the theme of Ek Rashtra, Ek Mission, Swasth Nari, Samruddha Vatan. That is instilled in us with her presence all around. I mean, pan-India, pan-world, I would say. For every minute problems we are discussing, there are so many projects Madam has started with us. That is anemia, we are tackling with the depression in the midlife. And there is a diabetes program is there. Study and prevalence of etiology of postmenopausal bleeding is there. We are studying on the adolescent problems. There is study for the postpartum, the abnormal bleeding in the women. So there are so many things which are going on hand in hand. And a very successful dimension of her is that she is with us in every moment. And wherever we are lacking somewhere, suddenly a hand or a backbone comes with support us and say, keep moving, I'm with you. That's what our visionary president Sunita Madam is sitting with us. And she has elevated the academics, the professional excellence to a newer heights. Being so many things in her kitty, I would like to acknowledge her as a very spiritual and a soul which is blessing everybody. And every meeting when she stands on the stage, she says it proudly, I love you all. That is the real essence of spirituality which is being conveyed to us off and on and at every moment. That keeps us going, sir. And her extended knowledge and environment, social well-being, the mental well-being, the health dimensions which is being extended in form of various projects is helping pan-India women in a larger way. We are doing so many camps under her wings. We are trying to elevate the medical status, the health status, and so many publications, so many books to enlighten us and take us a step further on the ladder of academics as well. So here I present Dr. Sunita Madam to say a few words of wisdom to us and keep us going in the same manner, the smiling attitude she wears, and keeps us always motivating. Over to you, ma'am.
Thank you, Archana. Thank you for generosity of word. I think Baroda and Gujarat is known for these meetha bhasha. I'm so overwhelmed, and I don't know whether I deserve all these words of appreciation, but definitely, sir, it is very important that when you lead the organization, you have a like-minded team members with you who are equally hardworking, honest, passionate, and keen to work on various presidential projects. If the team and you are not on a one common path, probably in 365 days, it's very difficult to achieve anything. All my team members, I have to just say them one thing, and they work beyond themselves and they get a platter for me on my plate. Now, today's subject when she discussed with me. I don't want to take out from her the subject and all, later only talk about, but getting the faculty of your level discussing the subject which is usually not discussed in any podcast or in our platform of OBGYN is going to add the flavor of our entire year activity. And maybe our podcast is telecast on all the social media. We may come out with certain projects with it, sir, because the work what you are doing is amazing. And it's not only amazing, it's a need of the time. It's a need. So probably we'll be very happy to listen to this podcast. And once Dr. Archana have your introduction, let us know all about you little more. I will join you from the another link, sir. And it's my pleasure and honor. And I'm thankful to you that you accepted her invitation and came on a Foxy platform. Foxy is honored, sir.
Thank you, ma'am. As I introduce our esteemed guest, Yuvraj Manvendra Singh Gohilji is a Crown Prince of Rajpipla, erstwhile princely state of Gujarat, and the 39th direct descendant of the 650-year-old Gohil dynasty. He is the first member of the royal family to openly come out of his sexual interest as a gay person to the world, and he is the only Indian to be interviewed by Oprah Winfrey 3 times and has been featured on the show Keeping Up with the Kardashians. He is the chairperson and co-founder of the Laksh Trust, which is dedicated towards the empowerment of LGBT community. He is also the brand ambassador of AIDS Healthcare Foundation India Cares, the world's oldest and largest non-profitable organization for HIV testing and treatment. Currently, he is developing his dream project, a LGBTQAI community campus at his royal establishment of Hanumateshwar for social and financial empowerment of LGBT community. There is one more dimension to him. He is a very ardent music lover, and I have listened to his harmonium playing events many times, and he is being a part of very many social activities for the Divyang, where they are into music or they are into some other things. He will be there, the first person to motivate with his presence. And sir, the library, I would not forget, he's creating a largest library for upgrading the knowledge of people. So it's a real essence of today is that your focus towards development of the society and giving what probably sometimes we feel that I needed to receive the same love. Sometimes when we lack or we feel that we want to give the community and hold their hands at the time of need. That is the real essence of what sir is doing nowadays, madam. And being in Gujarat and being evidence last many years, I have seen him to be a part of so many events, and he stands there, he sits still, and his presence itself is a motivating thing for many people. Over to you, sir. Today, we want to start this discussion where we are trying to break the myths and misconceptions when we talk about a transgender community. So, yes, ma'am.
Thank you. Thank you. And wonderful to meet you and wonderful to know about your work, sir. Definitely looking forward to meet you sometime over a cup of coffee.
Thank you so much, ma'am. Yeah. Thank you, ma'am. Thanks for the introduction and thanks for having me here on this podcast. To answer the first question, which Dr. Archana has posed, is the misconceptions which are the transgender community are facing. I think there are so many misconceptions, but I will name a few of them. So basically, a lot of people in society, they confuse being gay and being transgender as one, whereas it is absolutely different. One is a sexual orientation, another one is a gender identity issue. When you say you're gay, for example, I'm gay. I'm born as a male. I'm happy with my male figure, and but I'm attracted towards the male. So that makes me gay. Whereas a trans person is born as in one gender but doesn't feel like that gender. and wants to transition into the next gender. So if you are born as a female, you're not happy with your female body, you want to transition as a male. So then you are a trans man, and vice versa. If you may be born as a male, but you want to transition as a female. So you cannot compare the two together. I mean, they are two, both are different binaries, and so that is one major misconception which people have. Another misconception which people have about trans people is that, especially with the trans women or the Hijra community, if I'm talking specifically, then it's said that they kidnap children and they force them into becoming hijras, which is absolutely false. On the contrary, we have had cases where hermaphrodites are born in hospitals where they both the male and female sex genital organs are there, or in the absence of them, the doctor is not able to determine whether the child is born as a male or a female. And in that circumstances, most parents, they voluntarily like to give their children over to the hijras who are normally roaming around the hospitals when there's a childbirth is there. They're normally there in hospitals. So because the parents do not know how to raise their children, whether they should raise it as a male or a female, since it's difficult to say that during that age. So they're given to the Hijra community to take to and told to adopt. So it's not the Hijra community which kidnaps them, but it's the parents who give them to the Hijras to take care of. So that is another misconception, which the society at large carries about the transgender.
So very thank you, sir, for being a little bold on that and telling us the proper way which is being there. I know it is very difficult when we say when coming out is the word rather. So coming out before 1970 wasn't an option for anybody. So as we learn about the gender and the sexual expression, the LGB, then LGBTQA plus, acronyms will change and they will evolve too. But as a person, how difficult was it for you to come out?
See, somebody has to make a change. Somebody has to make a difference in the society. If you are just silent about our issues and you are not vocal, then nothing is going to change. We need to break the silence. There's a word called chuppi tod. Somebody needs to do that. Then we can expect change to happen in the society. So that's exactly what I did. I didn't like the way I was living a life of hypocrisy, being inside and something else and being outside something else. I was being dishonest to myself and dishonest to others. And I said, this cannot continue. I need to break the silence. I need to come out of my closet. And I knew that if you are doing that kind of a thing, one has to face a lot of obstacles in life. I said, I don't care. So long as I'm speaking the truth and I'm being true to myself and to others, let the obstacles come. I will face all of them and I will be successful because I always remembered one thing in my mind, and that is Satya Meva Jayate. Truth always wins. And I'm greatly inspired by Mahatma Gandhi. I've read his autobiography, and he's a great source of inspiration for me because when I read about him, I said on the basis of truth and honesty and non-violence, he was able to free the Britishers from, give us the freedom and get freedom for the Indians and get rid of the British. I said, why can't I use the same policy and give freedom to the LGBT community of India? So that helped me pave this path of coming out, and I definitely faced obstacles. But after all, you see, I'm in front of you, and I'm victorious, and I'm successful.
Yes, so that is very important to be yourself. That is the motto of your life, and that is very well taken. You do what your heart says and be true to yourself. That is the motto we should have. But sir, in the society, I mean, you must have also seen that if you have a boy or a girl who's not behaving to the norms of the society. Today we are actually accepting it more with a big heart, or maybe we are incorporating everybody. But back then, really, I mean, I have seen parents who abandon the child and go away. And or else the child is secluded, sent somewhere into isolation, or trying to tell that you are not the right person. So that type of a guilt or something which is being burdened by the child. Do you need to say something on that, that we have to accept the child as it is, rather than making him more depressed or isolated? Because a young person, as a young adult or as a teenager, or maybe a toddler, or maybe a childhood, the boy or a girl himself is not able to understand what's going on. So your take on that, sir?
Yeah. Yeah, see, one thing parents need to realize is that if they really love their children, then
Hmm.
I think they should accept the child the way he or she is, and especially sexual orientation, gender issues are not in someone's hand. You're born that way. It's like, if you're born handicapped, or if you're born visually impaired, will the parents throw you out of the house? No. I mean, it's not our fault that we are born this way. Then why is the problem? Why do they have a problem in accepting it? And that's why I always say one thing is that when it comes to issues of parents or anyone not accepting their children, I say one thing, that I do not blame the parents. My own parents had behaved the same way with me. I said I don't blame the parents, but I blame their ignorance. And why ignorance is because our education system has to be blamed. You know, uh, when I talk about parents of my generation, or even parents of the next generation, our education system doesn't talk about the basic sex. So where is it going to talk about sex, gender, sexuality, homosexuality, these kind of issues? So when my parents went against me, when they threw me out from home, when they disowned me, disinherited me, I simply said I do not blame them. I blame their ignorance, and it's my duty as a gay activist to educate them and bring them out of that myths and misconceptions which they carry about us. Even the first question which you asked me, what are the myths which people have about transgenders? My own parents thought I am a transgender. They didn't know I'm gay. For me, gay and transgender, for them, gay and transgender is the one thing, you know. And they told me, if you're a transgender, you should go and join the Hijra community. Why are you staying with us? And then I had to educate them and tell them that no mother, no father, I'm not a transgender. I identify as a gay man, and I do not wish to join the transgender community because I'm not one. You know, so it took me a long time for me to explain to them, understand. Today, they have come to that understanding that they have accepted me. But it took them while. My father, on the contrary, has gone to the extent of gifting me 15 acres of land. You mentioned it in your introduction. The LGBT community campus is in the royal establishment of Hanuman Teshwar, which was gifted by my father. And he also laid the foundation stone of India's first LGBT community campus. So you see the change which has happened from a homophobic father to a father who has gifted 15 acres of a royal establishment for me to build a LGBT community campus. So we need a lot of patience. But yes, if parents are listening to me, I would request them that please understand the child, please accept the child the way he or she or they is, instead of pushing them to that point where they are forced to, go into depression, go into suicidal tendencies, and be insecure in their lives.
That's very true. I think the crux of the thing, what you said, if you love somebody, you accept them as a whole, whatever they are. And parents or the mother or father's love is like a eternal bliss to any child. So I think we need to have a better perspective to see our child the way he or she is, rather than being judgmental or being influenced by the society. I think it takes a lot, sir, to wait patiently, to explain. But I would just like to, I mean, I'm not trying to trigger that, but how was the day when you came out with your reality to them or to the world? That very day.
So, see, I came out to my parents in 2002, and I suffered a nervous breakdown, and I was hospitalized. And the doctor was treating me, the psychiatrist. He was wanting to know what is the reason of my, having to come to the hospital. And then I came out to the doctor initially, and then the doctor was extremely kind and extremely, progressive. He said, "There's nothing wrong in being gay, and I will help you to come out to your parents." And then he called my parents one by one, counseled them, told them about my situation, why I'm suffering is because I'm closeted, and he tried to explain to them that they should accept me. And it was expected that they never accepted me at the first chance, and they said, "No, it is a disease, it is a disorder, this should be cured." And they went around different doctors, psychiatrists, wanting me to be cured. And the doctors told them that, "Madam and sir, you're wasting your time. He cannot be cured because it is not a disease." And the thing which came to my rescue was that I was also born left-handed. So I used to write with left hand. I still write with left hand. I eat with my left hand. And in our culture, left hand is not supposed to be a good sign. So again, my parents took me to a doctor saying, "Please make him right-handed." And the doctors refused. They said, "No, it's not possible. You cannot make your child is born with a left hand. He will continue to be left-handed. You cannot make him right-handed." Similarly, the doctor said, "Your child is born as gay. You cannot make him straight." So it took them a while to, come to terms to my sexuality. Because, see, I want to tell you another thing. Parents may accept. I've seen a lot of cases parents accept, but it is the society around them which, doesn't want the parents to accept them. And they are the ones who kind of try to cause problems and instigate the parents. "Look, what are you doing with your son? What you're doing with your daughter? You're not getting them married. You know, you're failing as a duty of a parent." So the instigation by the other people around is the worst thing. So, but parents need to be really, as I mentioned, be, the accept the fact that whatever the people say, it is after all your child, and there's nothing beyond, the relationship between the parent and child, which should be understood rather than people talking about the children.
Yes, sir, that is very true. I mean, societal influences are so much. We can see it at the peer pressure, and when the child even enters the play school, there is so many things already bombarded on the parents around, and they forget their role to support the child at that point of time rather than listening to others and being influenced by that. And rightly said, as you said, that the doctor was very good. So you had a valid point that we as academicians or the doctors should not be judgmental in our treatment. So that is something you have got a very good point that my doctor was good. So I think that was conveyed so beautifully that still you remember that. So at this platform, probably we both and Sunita ma'am and our Fogsi team wants to request that whenever the patient comes to you, see him or her as a treatment or a guide or a mentor at that point of time, rather being judgmental and guiding the treatment with something else in your mind. So thank you for bringing out that valid point, sir. And do you think that the myths to be broken is very, very important, and you need to address certain problems which the youth is facing as a youth, because mental health is an important issue whenever you are into this umbrella of having the sexuality difference. I mean, the mental health suffers a lot. Do you want to highlight that point, sir?
Yeah,
Because it's an important issue.
definitely. Through my organization, Lakshya Trust, we were the first organization in the state of Gujarat to have conducted a mental health study amongst the homosexual and the transgender population, and we found some very shocking, observations. Which this was done with the help of the government of Gujarat under the mental health. There's a mental hospital here. So, with under the supervision of the mental health practitioner, this study was done, and 80% of the people the respondents we interviewed, they were suffering from depression, severe depression. There were a lot of them who had suicidal tendencies. A lot of them had were suffering from schizophrenia. And it boiled out that they were not like this. But it was the stigma and discrimination which is caused by the people around them and their human rights getting violated at home, at education institutions, in hospitals, is what is causing this problem. So mental health is a really important issue which we need to address, especially amongst the LGBT community, because it is not that we are, when that's another misconception which a lot of people carry, that homosexuals or transgenders are people with mental disorder. It's not that we are mentally sick. This is, as I mentioned in the past, it is not a mental disorder. Even the American Psychiatric Association, way back in 1978, has had ruled that homosexuality is not a mental disorder. Now, even the Indian Psychiatric Association says it is not a mental disorder. But we need to even educate the doctors. There are still doctors, there are still psychiatrists who are not, they are doing many unethical practices where the parents take them. I have come across doctors which are prescribing sleeping pills, tablets to the patients when they come for these kind of things, and they are kind of uh, supporting the parents and telling, no, your child is mentally wrong with him, and he should be subject to conversion therapy and things like that. Now I'm hearing conversion therapy is banned in India. The Supreme Court of India ruled that conversion therapy should be banned, and the people who are trying to subject the community into conversion therapy should be penalized for it. Even I've had a word with some psychiatrists and all. I said, how can you, uh, you know, uh, uh, indulge in this unethical behavior? You're a doctor. You should be treating the patient. You should not, if a person is not abnormal, not having a mental health issue, you're forcing the person into go into mental disorder. That's completely wrong. So
So
these
there's
things need to be done. Coming to the same point, is education problem.
network error.
Yeah, it is the education which has created this problem. So one has to deal with that.
So I think you perfectly said that marginalization and social discriminations, facing barriers in different aspects of life, is the mental issue is created because of these things. Any person is
Yeah,
born with a sound mind, but too much of pressure, everybody has got a different level of bearing it and expressing it. Like, I think
yeah,
it's a motivation that you had patience to carry forward yourself in spite of all the odds. Maybe some person would not be that strong, so those people give way to certain things where they really never wanted to go there. So I think society and we need to be more supportive in this. Acceptance is the key, because we I'm sick because we includes everybody. The denial phase becomes so prolonged that the acceptance phase comes at a fag end, where the person or the individual is already mentally or societal harmed already. So probably we need to be awakened and be aware at an earlier stage, as sir already said, that it is a behavior, a sexuality expression in a different kind. They are not who need to be treated. They need to be accepted and accepted as they are. That is what I think, sir, you meant to say very much. But there are certain facts which I would know that you have been seeing the society when you came out, and the society as of now. Do you feel people have developed or evolved or more better in Indian terms? Because internationally, I think the acceptance is higher than here, probably. But do you feel that there is any societal change over a period of time?
yeah. Definitely, things have changed since I came out of the closet, and I'm glad I took this step, because many people ask me that uh, did you make a mistake? I said no, I didn't make a mistake. Yeah, I do realize I should have come out much before I came out. in 2006, maybe the world would have changed much faster or better. But definitely, one thing is for sure that we have created a lot of allies. And I am always believer of that allyship. We should have more and more allies. An ally is a person who is not belonging from the LGBT community, but openly wishes to accept and help bring acceptance in the society. And I'm seeing allies coming from all walks of life, from political fields, from religious backgrounds, from government level, from parents, from education institutions, from media. A lot of people are coming out and accepting us and wanting to be our allies. And that's one thing good because I feel that it is the allies which are going to help us mainstream our issues in the society. If I keep talking about LGBTQ, people are not going to take me seriously. But if a person like Dr. Archana will say that please support them, you will be taken seriously because you are an ally. You know, so we need people like you. We need people like Smita ma'am who are true allies and want to help us. And it is the allies which are going to help spread the word and break all the myths and misconceptions. Just to give example, we have spoken about parents. Let me tell you that I am really happy that India has started an organization called Swikar. Swikar has been started by parents who have accepted their children as gay, lesbian, bisexual, transgender, whatever. Now there are more than 300 parents in India who are part of this organization called Swikar, and they come from all over India. And I'll give you an example. During the pandemic, when there was work from home and we were forced to go back home, that was 24/7 harassment by parents to get married, for the LGBT community. And that time, a lot of them came to me and for help. And I contacted Swikar. And with the help of Swikar, we managed to convince almost 15 set of parents to accept their children. Today, those parents have not just accepted them, they have also looking out for partners for them. So that is the change. That is what I think is the change which is happening, and much more is going to happen. I'm very sure about it. Whether it is education institutions, so many youths are inviting me to come and talk in their education institutions. They like to come and intern with us in organizations. The youth of today is very curious. They are very much wanting to know our issues. They are wanting to, and see the youth. It's easy to change them because they are very flexible. And youth of today is the future of tomorrow, future of our culture. So I think when somebody asked me, what do you think about the future of the country about with the LGBT issue? I said India has a very bright future.
So well said, sir. I think the support groups always remains the main forte. The more you are attached, more you are talking to people about your problem, the things are more easily solved.
Because exactly.
So some network is, we cannot hear you right now. Yeah, you're back, sir.
Oh, yeah. Yes, you can ask me the next question.
Yeah. So you were talking about the youth, sir. So youth is something which we represent because it is going to be the future representation of any country or any state or any small place as well. So when you talk about the HIV/AIDS, there is a myth that people who are under this umbrella are more suffering from AIDS, and which, as a doctor, I know it's a myth. It is equally common with any sexual practices if they are not with a proper guidance. So how do you tackle the youth who are suffering from like little uneducated, I would say, still about the sexual awareness, the use of condoms and other things? So since you're working on this field, so how do you educate them, sir?
Yeah. So I don't know if you know, you are aware of this, but even before the word HIV was coined, it was called GRID, gay-related immunity disorder,
Yes.
because that time it was thought that HIV is spread only through homosexuals. But then later on they came to know that that is not true, and that's why the word HIV came. So it's very unfortunate. Anything bad, evil which comes to the society, we are to be blamed. Even when monkeypox first came into the world, they said, oh, these homosexuals have got monkeypox. So it's so unfortunate that we are blamed for no rhyme or reason. We were not even responsible for monkeypox, and I'm so happy we were not blamed when COVID came. Otherwise they would have said even COVID these people have got. So it's that's what has been happening. We are being made. We always wrong allegations are made against us when we are not anyway connected with HIV or monkeypox or corona as such. So, but then at the same time, as I mentioned, we need to educate the masses. Yes, definitely, we are a vulnerable population where HIV infections are high in our cases. But that does not mean that HIV is spread only through homosexuals. It is the general population in which it is spreading, and we need to control it. And the only way you can control it is by doing two things. One is we need to increase the HIV testing, because not many people have got tested in this country. Unless you get tested, you will not know your status. And the moment we know that the person is HIV positive, we immediately start that person on treatment. Because treatment will reduce the chances of transmission of virus from the other person. If you are regularly in your ART drugs, then you will be definitely able to reduce the transmission. That is one. Number two, we are doing a lot of condom promotion activity in India through AIDS Healthcare Foundation, India Cares, of which I am the ambassador. I'm proud to say we are the first organization in India to have started a free condom store. And we supply, or we rather send condoms to anyone who wants in India, free of cost, even free home delivery. And why we started this? We realized that there's so much of stigma even going to a medical store to buy a condom. So we decided that if we have this store, we'll be able to reach out to more number of people and we will be able to save so many lives. So we have been doing that. We work with the government. We are currently working with the states where HIV infections are highest. Northeastern part of India, the HIV is highest. Mizoram is first, Nagaland is second, Manipur is third. These are the highest infected states in India. So we are working with them. We're working on migrant population. We are trying to reach remote parts of India where testing is not happening. We also we managed to convince the government to start the rapid test kit, because earlier the blood sample would be taken and you would know the result after 48 hours. And by the time that person has not come back to take the report and you lost that person, and that person is positive, then he or she is spreading the virus and you don't even know where the person is. Now we have started the rapid test kit where you come to know your result within 15 to 20 minutes of giving the blood sample. So at least the patient is in front of you when you're giving the result, and then we do our pre-test counseling, post-test counseling as usual it is done. And that way we are able to, see that when the person is positive, then the treatment can be started. So with condom promotion, we are taking help for a lot of students. We celebrate something called International Condom Day every year, which is one day prior to Valentine's Day. 13th of February is celebrated, and we try to engage a lot of students, a lot of youth population. We organize fashion shows. We even got in touch with the Fashion Institute where we got the students to design entire dresses made out of condoms. And we have had contests, we give them mannequins and we tell them, okay, now dress this woman into make her into a pretty woman, and they'll make a hat, they'll make purses, they'll make dresses, everything made out of condoms. So those are the things, activities we make the students do to make them realize the importance of condoms and why it is important to protect your sexual, have sexual protection, so that you are not getting infected and you are preventing transmission to other person.
Perfectly said, sir. So that is a barrier contraceptive method, which is very, very important. Whatever your sexuality is, prevent yourself against STD is something which is very, very important. And you're doing a great work, sir. Thank you for giving us more ideas on that as well. And since I'm representing some midlife management crisis as a Foxy chairperson, so do you think that aging, not as a male or as a female, in the, like I would say, transgender or the sexuality community also, the aging is there. There are problems of aging. So how do you feel? What changes you feel, and do you want to see the doctor for that, or what else you are planning about it?
So, again, my organization was one of the first organizations in India that started working for community. And I think which everyone has to encounter. It doesn't matter whether you're straight or you're gay or you're bi or lesbian. We all have to uh, get old one day. No, we have to accept that fact. And with the aging issues comes many factors: health issues, insecurity, loneliness, mental health issues. So we have started a project in Baroda where we are taking care of the senior citizens from the LGBT community, where we are doing a lot of outreach. We identify them, we go meet them, find out what are their issues, what do they need from us. We are providing, even some of them are living their lives all by themselves without any family. We are having tiffin service, and the transgenders themselves are providing tiffin service. They make food, we supply to them, we entertain them, we take them out for picnics. And so that, see, the whatever years you are left with, we try to see that the last days of your life, they are able to live with dignity and respect and with a comfortable lifestyle. So those are the things which we are taking care of, and of course, health wise also, whatever physical health, mental health issues they have, we are taking care of. Their diet is something. We even started yoga for them, yoga and meditation. I am myself a trained yoga teacher, so we have conducted a lot of yoga sessions with them, meditation centers, sessions with them, to see that they are mentally calm, poised, calm, and they don't have mental health issues with them through meditation and these kind of techniques. So many things can be done because aging can be something which the fact that you're old will not kill you, but the loneliness will kill you. You know, I've seen older population. Don't want to live because they think who's going to take care of them. You know, that the loneliness factor is there, which kind of uh, brings negativity into them, and they think, oh, why should we live now? Who's there for us? That kind of thing. So we have to take care of those kind of issues if we have to see that they live a healthy lifespan.
So I think you very well mentioned, say, yoga and meditation. Yoga itself gives you the mental calmness which you need. And once you're doing the exercise, I think the joints remain mobile. You do your work yourself. And that happens to anybody, as sir already said, whatever sexuality you are, but keeping yourself fit and fine is your moral responsibility. So I think regular health checkups, taking care of the comorbid conditions is very important to lead a healthy lifestyle, because anybody who has been given life by God needs to respect that and take it further with a happiness only, because there will be barriers, there will be marginalization, there will be so many issues, whether it's the form of sexuality in a form of other grounds, but then there are many disorders which are being detected daily in life other than this. But we need to be very positive, and positivity does come when we work out in a group, and yoga is one of the form, and sir is himself a teacher, and taking sessions was a very enlightening thought process, sir. I mean, helping the people in this way gives lots of blessings also, because they really feel very good and peaceful and wanted by people. I mean, as you said, loneliness or the emptiness syndrome, where everybody fled off, now you're all alone. Probably seeking help with the mates together in the group, working for a cause as you are doing so much, would help them and give them a meaning that they are here in the life for some cause. So taking it further, sir, what myths you think needs to be broken at this point of time on a strong and a firm background when we talk about generally a sexuality term, or maybe giving them equal rights?
See, most of the problems lie with our ignorance on certain issues and the wrong conceptions which we carry about anyone. We are always judgmental about many things, and there are these stereotypes that if you're a boy, then you should be playing cricket. If you're a girl, you should be playing with a doll. These are the stereotypes which have this mindset with us. What we don't realize is that there is the other side of the coin as well, which we need to accept. And
The network is.
cricket, and that also, that they could be also do that. That's something which each one. Is it better now?
No, it's better
Hello?
now. We can hear you now.
Yeah.
Hear you.
So yeah. So I think the first and foremost thing is that we need to break the stereotypes. That's what I started my answer with, and breaking the stereotypes is important in order to break the myths and misconceptions we carry about people. And we tend to be very judgmental towards and biased towards certain opinions which need to be changed. And this could happen when you're talking with a person with a lived experience. For example, now you're asking me these questions. Now I have lived that I have gone through that journey, those obstacles in my life, and I'll be able to understand the position of a gay man much better than anyone else would. So it's always good to talk to people like those who have gone through that in their lives, rather than like going to internet or going through reading books and all. Lot of time internet doesn't provide the right information. So I always tell people, if you want to know about homosexuality, you meet a person, meet a gay man, meet a lesbian woman, meet a transgendered person, and ask them questions, and ask them what they have gone through in their lives, and then you will be able to understand better, rather than going on Google or some and finding out in that way. So that is one thing. Secondly, I think there are many issues which a lot of us face when it comes to being transgender. And I'll give you one example. Where I work with a lot of corporates, and who I'm trying to see they are giving employment to the trans community, because see, everyone has a right to live with dignity and respect. Nobody wants to live a life full of humiliation and shame and violation of human rights. But at the same time, I tell them that if you're employing somebody from the community, you also know what issues they are facing. For example, trans men, for example. Now, trans men are born as females, but they transition into male. But now, lot of them don't realize that even a trans man can have a menstrual cycle. Because suppose they are not on regularly into the hormone treatment, they have transitioned, but not necessarily they have removed their ovaries. Not necessarily, they may be having their female sexual organs also. So they can also have menstrual cycle. They may also need sanitary napkins. So those are the things which we try to educate the people that look, this is what you should know and you should understand and accept it, so that you have a trans man working. Then you should know that what
So the network.
So again, coming back to education, and is it better now?
Yeah, the voice goes. Yeah, this is good. So you can
Yeah.
speak, sir.
Yeah. So educated literacy is important. You have to make a person educated, literate, to understand our issues better than, because you may be highly educated, but you may not be literate enough to understand our issues.
So I think Sir has pointed up very nicely that education is the key to success, key to growth. But only thing is that the right to education prevails for everybody. So parents, please don't shy away sending your child to the schools, regular schools. And I would request to the parents of other children and the children as well that incorporate them as you only. Because when you seclude or when you misbehave or maybe somewhat type of becoming judgmental, as you said, you are directly or indirectly harming an individual's growth. So I think one keeps patience. One can be bullied as a normal child as well, but I think restoration of peace and self is a very, very important thing, which we all need to learn at a very younger age. So troubling somebody or coming in the way of their growth is not a good idea. I think none of the parents taught any child this way. So this is something which you all should keep in mind. And so you have brought up very good things with a very good example. Any take-home message you would like to give, or any weird thing you remember in your lifetime which brings a smile on your face, you can share at this platform to keep us motivated.
I think I'll always like to end my talk with one very simple message for everyone and anyone listening to me. It's not, you do not necessarily have to be from a particular community or particular caste or religion or creed. And it's a very simple thing but difficult to practice. I always try to encourage self-love. You should learn how to love yourself. If you are able to love yourself, you can spread a lot of love. You will be able to reduce a lot of hatred. You can reduce a lot of phobias, lot of fears, and believe me, it will be a wonderful place to live if you are able to love yourself. It's as simple as that. So that's something which I would like to end my talk with.
Thank you, sir, for so much time you gave to us. I know it was a very hectic schedule of yours, but I mean, the take-home message of being self-love, I think that has, you are an example of it, that you have grown over a period of time, sufferings. There were so many obstacles, there were so many things, so many people you must have met across, giving you positive, negative vibes, but surviving against all odds. You have stood up as a candle to the people who are in dark and looking forward to you. And I mean, you're helping so many people with the Lakshya Trust, and now with your parents incorporated with the landscape and everything. Probably we are heading to a nation who is more fulfilling, goal-oriented and focused people who are there for a cause and would be a society bearing the torch for us, and like you over here and our President Sunita ma'am, who is also torch bearer, teaching us everyday life, and we are learning so much from her. And we are extremely thankful for this platform given by Madam as a committee chairperson to Midlife Management Committee, and Sir taking out time, Prince of Rajpipla, and we all know that we are very close to you, and we are very happy and proud to have you, and from Baroda and Gujarat itself. So keep going, sir. Any help from our doctors community, we would be there to help you at any point of time. And before ending the session, I would the sense of gratitude and prayers to God to keep blessed everybody and give them the insight to help the person, help the spirit, the individual as such, rather than being an obstacle to anybody. This is the thing which Sir has conveyed so nicely to us. And as a positive epitome of smiling here, we have Prince Manvendra Gohilji sir, who has survived against all odds and telling us the message that keep going, keep having self-love to yourself, keep oriented and focus towards your goal. Forget what is going around you in the negative vibes. Be positive always. Thank you, and a very good night to everybody. Thank you, sir, for sparing time to us. And I'm thankful to Dr. Sunita ma'am for giving us this opportunity to share the thoughts with the people over here. Thank you, delegates. Thank you, everybody. Good night. Shabba khair.
Thank you. Thank you so much. Yeah.
Thank you, sir. Thank you.